Hello, everyone. Welcome. My name is Jessica Gonzalez, and I am the School Mental Health Coordinator with the Mental Health Technology Transfer Center Network, also known as MHTTC Network. Thank you for your interest in our School Tele-Mental Health series. Today's session focuses on enhancing family-school partnerships through telemental health. This is session 2 of 3 in the series. I want to quickly thank our lovely speakers and MHTTC colleagues who assisted with planning for this session. And a big thanks to all of you for joining us today. We truly hope that you find today's presentation helpful. Next slide, please. So we have made every attempt to make today's presentation secure. If we need to end the presentation unexpectedly, we will follow up using your registration information. All attendees are muted and cannot share video. If you have a question for the presenters, please use the Q&A pod. If you have a comment or a link that you'd like to share with all attendees, please use the chat box. The session recording and slide deck will be posted on our website within a few days. You will also receive an email following the presentation on how to access a certificate of attendance. And if you don't already, please follow us on social media and stay in touch with us. Next slide, please. So for those who are new to the MHTTC network, the network accelerates the adoption and implementation of mental health related evidence-based practices across the nation. We develop and disseminate resources and provide free local and regional training and technical assistance for the mental health workforce. Next slide. Here's our lovely map displaying the centers that make up the MHTTC network. We have 10 regional centers, a national American Indian and Alaska Native Center, a national Hispanic and Latino Center, and a network coordinating office. After this presentation, please visit our website and find your center so that you may stay up to date on trainings and resources offered in your region. Next slide. The MHTTC network has a 3-year supplement to expand training and TA on the implementation of school-based mental health services. School mental health specific activities that are put on by the MHTTCs through our School Mental Health Initiative encompass multiple service modes, various topic areas, and populations. Next slide. Our webinar series is just one example of the training that we offer the school mental health workforce, all free of cost. Next slide. This presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. The opinions expressed in the presentation are the views of our speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. Next slide, please. As part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. At the end of today's training, we ask that you please take a moment to complete a brief survey about today's session. Next slide. Okay, now we're ready to get started. Next slide, please. We have 2 presenters starting us off today who will discuss equity in school telemental health. We have Angela Castellanos, a licensed clinical social worker with 25+ years of expertise in the mental health care industry and school settings. She specializes in administering school mental health programs, mentoring industry professionals at the local, state, and federal levels. We also have Dr. Kazike Prince, who provides executive consultation and coaching services focused on cultural competency for individuals, teams, and organizations. Next slide, please. Angela and Kazike, thank you so much for being with us. I'll pass it off to you now.
Thank you so much, Jessica, and good morning, everyone. Thank you so much for being here again. I'm gonna have Kazike start us off today, this morning.
Well, thank you, Angela. Appreciate it, thank you, Angela. I wanted to just take a moment because I think many of you are very much aware of the death of George Floyd of Minneapolis, Minnesota. And I thought it would be important that we recognize this because as we talk about equity, diversity, inclusion, these are kinds of issues that I know many of you are struggling with and battling with, and also the people that we serve are also battling with this. So as we engage or try to work with folks, I think these kind of collective traumas many of us are managing need to be attended to. And so the hope is that while we are in pain, that we experience the kind of clean pain that allows us to grow, and then hopefully avoid the dirty pain that oftentimes it exacerbates or expands the kind of pain that many of us are experiencing. So I just want to take a moment to acknowledge that, and I'll move back to Angela. Thank you.
Thank you so much for that information. I know that it's been over 12 weeks that we've experienced school closures, and we've all had to adjust to different pieces connected to the pandemic. As being clinicians out in the community, we have experienced a variety of different situations, right? And one is really having to adjust to delivering services in a different way. We do have a lot of information that's out there in regards to some of the impact, regarding school closures on families. And we have a lot of anecdotal information, a lot of data that's out there. And some of us have experienced this piece as we're delivering services to.
Angela, you're cutting out a little bit.
It looks like we're having a little bit of technical difficulty with Angela's audio. I don't know, Kazike, if you wanted to expand any further on maybe some of the comments related to the impact on school closure on families. I know that Angela had prepared some comments before we move into our slides. You talked a little bit about collective trauma that we're experiencing in this unique context. If you have any, do you have any other further comments or information you'd like to provide related to that?
Hopefully you can hear me, yes?
Yes.
Yeah, I think what Angela was trying to highlight is this is a kind of a new collective struggle that many of us are not quite know what the answers are to it, but I think what's been important here is our willingness to be to go sometimes checking out how their needs are, because the situation we're in is so unique, requires a different approach. I see Angela has joined us again.
Hi, so this is one of the barriers, right, is the loss of technology within, servicing students. So I apologize for that. Thank you so much for your patience. But, part of the conversation was that this is a collaborative survey. And so these are some of the different pieces that they highlighted within this particular survey. So one of the things that they found is that 1 out of 3 parents, they didn't have health insurance. Even though their kids, the students or the children had coverage, most of the families did not have medical insurance. 1 in 3 parents did not have access to email addresses. And the other piece too is that more than a quarter of parents did not know their student was turning in work. That's about 25%. That's a lot of students or families that were not aware in regards to what type of schooling was available for the students. Even though families were receiving the right devices for or equipment necessary to participate in online classes, 21% still did not participate in distance learning opportunities. Part of it had a lot of things to do with access, being able to access emails. Also, a lot of the families experienced a lot of financial losses. And so within the community, they had to decide, am I going to pay for Wi-Fi this week, or am I going to buy, groceries? And so there's been a lot of information in regards to family engagement. In the next slide, I talk a little bit about some of the different creative measures to follow up with some of the families in regards to family engagement. The statistics on the previous slide, they're California-based information, but I'm sure these are some of the different pieces that you actually were able to see as you deliver services to families in the community. So, these are some of the different pieces in regards to family engagement. I think as we start to develop, most of the schools right now are transitioning into the summer. Part of the other conversation is having information for families. I think as educators, we want to make sure that we are training the frontline staff to really engage and have some connection with the families to understand what the barriers are in regards to engaging, having that consistent check-in with families, and also making sure that the information is accessible in the language that the family is comfortable with. The other aspect too that they discover within the survey is making sure that the families are connected to digital, education, right? Helping them set up emails, making sure that they get that training available for families, and ensure that they have access to technology as well. The last piece too is as we're transitioning into wrapping up the school year, a couple of things to consider. One would be to really help families how to close up in a positive way, to really instill the hope that Kazika was mentioning earlier in our conversation right now, and also making sure that there's still communication with the families and engaging them in how to develop or create a healthy summer, right? Because most of the families were really relying on school-based services, connection and resources, and we want to make sure that there's still the opportunity for them to connect during the summer, and then also being available to make sure that they're connected to what is this reentry plan going to look like when they come back to school. At this point, a lot of schools are still trying to figure out how is this going to happen, right? Is it going to be a hybrid type of model? Are we going to do 100%, brick and mortar? So it's really a scary time. We know that not knowing information creates a lot of anxiety. So it's really important just to collaborate with families, having that connection, and also collaborating with agency communities as well to make sure that they're offering the support that they need for this particular time. Is there anything else that you wanted to add, Kazika, to this process here?
No, that was really great, Angela. So thanks a lot.
All right, well, that wraps it up for us. Jessica, thank you.
Thank you so much, Angela and Kazike. I see some great comments in the chat box and also a question or two in the Q&A pod. Angela and Kazike will try to answer as many questions as they can in the Q&A pod, and we will also use the second part of the session today to have our presenters answer some of those questions live. So please continue to submit your questions in the Q&A pod. Next, we have Dr. Brandy Clark. Brandy is the project director for the Mid-America MHTTC and an associate professor and licensed psychologist in the Department of Psychology at the University of Nebraska Medical Center. She has over 15 years of experience conducting research and providing training and services related to mental and behavioral health for children of all ages in various settings. Next slide. Brandy, thank you so much for being here with us today. I'll pass it on to you now.
Thank you, Jessica. And thank you, Angela and Kazike, for helping to really set a tone for today and context for how do we put this work that we do into a frame where we really are thinking about all families and how we meet those needs, as difficult as we know that that might be. Today, we're going to be talking about what our work looks like when we work with families as partners in supporting student mental health, not just now in the context we're in, but how we think about it always. And I'm going to be honest with you as I set this up. This content was somewhat difficult for me to put together. Not because it was hard to figure out what went in it, but what I left out. This is actually an area of work and research that I've spent many, many years working in and feel quite passionately about, and to reduce it down to just a brief presentation was actually quite difficult. So keeping in mind that this is not necessarily the easiest work that we do, and that today I'm going to be presenting information in a really concise format. No, there's certainly not going to be an exhaustive list of information, but hopefully what you'll leave with here today are some ideas for how you can engage in this work in a time where things are feeling overwhelming, things are feeling stressful. How do we help maybe simplify some of this work in a way where it feels manageable? How do you also leave today with hopefully leave with some tools that can help give you some resources that are easy to engage with, easy to pick up and use right away, and also then some tools that you can use in reflective practice for where do you go next. So hopefully that's what you'll walk away with today. So next slide, please. When we talk about partnering with families, it's important for us to really think about the why we do this work, not just the what we're doing. And engaging from a framework where we think about the importance of parents in the work that we're doing to support student mental health. And we know that parents and our familial factors are single-handedly some of the biggest levels of influence in the life of a child. And then if we can create supportive family relationships or support those, help provide clear, predictable expectations across environments in the home and at school, we're really helping children to thrive. And so it's important that we put this work into context when we talk about partnerships. We're using that word in an intentional way, and it means then that we're also acting intentionally in creating them. Today, when we talk about partnerships and engaging families, and we're really going to be talking about kind of two levels or dimensions here. One is how we're engaging families in the supportive work that they do, or in the support that they provide for their children, but also the way that they engage with us as providers. So there's two levels of engagement here that we're really talking about in that partnership. Next slide, please. In the work that I've done in other schools and with other partners, what we've found time and time again is that if we came in and focused first or solely on the what to do, what we found is our actions really fell flat if we didn't first stop and develop a really clear approach to why we're doing the work that we're doing in the way we're doing it. And so the work that you see here, this figure that you see here, the 5 A's is a way that we tend to reference this, helps us to think in a really structured format about how we engage with families and partnerships. It's about more than just our actions, but really the way we set ourselves up to be successful. And so we talk about our approach, our attitudes, and the atmosphere we create as being the prerequisite conditions that have to be in place if we're going to have effective actions that create partnerships. We spend just a little bit of time talking through those here today. When we think about the approach, this really is about this belief system that we hold, that we have a shared responsibility, families and schools together, for educating and socializing children. Both families and educators are absolutely essential to this development, that one can't do our work effectively without the other. And that belief system is what holds as our framework, our basis for developing a partnership. The other piece to this is that in our approach, the emphasis is always on building relationships, not simply getting jobs done, not simply getting our work done, but really how we engage each other in a way that's very relational and intentional about that. And that is critical up front, that we're coming in with that mindset, because that then shapes the way we engage, the way we interact with families, and the invitations that we make for them to engage with us. The part about attitudes, I wish I had more time. I love spending time on this particular piece of the content and reflecting on the attitudes that we bring and hold at our core when engaging with families. First and foremost, do we have an attitude that all families have strengths and that all families can and do support their child, even if it's not in the way that we see or in the way that we might want them to? That holding those beliefs and attitudes is important to engaging with families as a partner with us and seeing them in that light. Thinking about the attitudes we hold about that parents come to the table wanting the best for their child, even if, again, it's not the same as what we might think about. is being best for the child. That they genuinely do want that and may engage in a variety of ways to make that happen. Another important attitude related to building partnerships is that there is no room for blame. And if we were in a classroom setting, and when I've given this presentations before, that I would actually stop and have you all recite this with me. So you can just stay back silently. There is no room for blame. If we really truly are going to be about partnerships, we have to think about our interactions in that way. If we're coming to the table, engaging folks as partners, that our work needs to be about the way we engage together, not the way we make or get the parents on board with the work we're doing. And that really is a different type of attitude and a different type of approach than to the way we get our work done. We're going to come back to this topic just a little bit later in some other slides about then how we engage in reflective action here. Atmosphere in this particular context refers to two different types here. One, it's the physical climate that we create. Is it open? Is it inviting? Is it welcoming for our family, for all families, when they engage with us in a school setting? And two, the affective climate that we're creating. Do they feel welcome and invited and respected when they engage in these partnerships with us? And that we're going to be talking about this context of how we do this via telehealth today. But again, that atmosphere is always a piece of that partnership. How do we create it in such a way that both we physically sense it and we affectively sense it as well? That I truly am respected as a partner when engaging with the team who's here to support my child. But those prerequisite conditions are a part of then setting the stage for how our actions will be perceived and whether or not they will truly be as effective as we want them to be in supporting the learning and development of the students that we care so much about. And why I start here, because if we're gonna then talk about the next steps and the actions that we take, we really need to be mindful of the approach from which we're taking them. Next slide, please. So we started off the conversation a little bit today with Kazike and Angela's presentation on putting things into context. What is it like to try to partner with parents around this work of supporting student mental health when we're in the midst of a collective crisis, collective nationwide, worldwide crisis? And how is that impacting our parents as partners and even ourselves as partners as well? What does this context mean? And you saw some of the data that was presented, that Angela presented. It was very fortuitous for me that APA also just released their results on their stress study, collected between, I think, mid-April to early May on the stress index nationwide. And what we're seeing is, I think what you might expect, that parents are actually reporting significantly higher levels of stress related to COVID than are our non-parents. And one of the biggest reasons why is this stress over distance learning and what that means for them as parents who are also trying to now work and be productive from home. And so putting that into context, we're also seeing, and as Angela mentioned, a significant source of stress for parents includes meeting basic needs, healthcare services, and missing major milestones in the lives of their kids. Kazike also brought to bear today that we live in a context where we know equity is an issue, and what we're experiencing here with our COVID pandemic is one of those things that we know exist are hitting us smack in the face even more than bringing it to bear, that our families and children of color are significantly more likely to experience stress related to COVID because of the situations that they find as well. And this creates this context then under which we're trying to work together and provide some support. I'm not, the piece here that can't be left unsaid too is the levels of stress that we're experiencing as providers or our schools on the back end. Our educators are also bringing a level of stress to this context too. So what does it look like then when we try to partner with each other when the levels of stress are really high all around? So next slide, please. So the ways that we can try to work through that is how we can help bring some peace to our situation as best we can, and simplify some of the work in the ways that we are trying to engage, in the ways that we are trying to partner with each other. And in our own work as clinicians, we've tried really too to help to simplify and make things a little bit easier, kind of giving ourselves some focus. And at this time, giving it a focus on what we would call the 3 R's. How can we help promote routines, relationships, and regulation at this time when things are rather difficult? Next slide, please. And I do not mean for this to be oversimplified at this point, but rather to give some context for how we might be able to give some tools to help manage things in a way that could be easily digested and easily received at this time, that can help us to focus on those elements that really will help to ease perhaps some stress within our households, within and also help to support our students. So first things first, if we can figure out how we help create flexible yet scheduled routines that are easy to manage, that also can play to the strengths of our students for things that they can manage somewhat independently, while parents are also trying to work and do some things within their home. How do we help set those clear expectations for what these new routines will look like? And include within those focus on healthy sleeping and eating habits, because those are sometimes the first things to go when we're under a lot of stress. So focusing on helping families to set new routines, and routines that can be easily managed, is one great first place to start. Within that, keeping a focus too on relationships. And we did a focus group with some school providers here a while back, and talking about what some of the things that they're seeing is being, strengths that are coming out at this time, but also some of the barriers that they're facing. And one of the comments was said, I find that in this time I've had extra family time, and that's a good thing. And in the same breath said, as a barrier, I have extra family time. That is also impacting all the other parts of the day and productivity and trying to work from home. And so one of the ways as we think about relationships is how we can still maintain some family time that doesn't feel stressful, that feels fun, that feels engaging, and keeps things simply focused on building relationship, maintaining relationships within the family that at times when they're not stressed. And scheduling can be one nice way to do that, building it into the schedule where there's time to make it happen, and parents don't feel an obligation to have to play all the time while they're trying to get work done. That is easier said than done, I know. Also helping to think about not just relationships with families, but how we can help support families in setting up ways that students and children can continue to engage in social relationships that matter so much to them in these times, how they can still have safe social activities with others, video chats, phone calls, emails, maybe teach them the old skill of letter writing, which some of my kids have been doing a little bit, but that they can still find safe outlets and ways to make that happen. Within this piece, teaching social distancing expectations is something that actually our kids don't quite understand and never quite experienced before, and it does require some intentional teaching for them to know and understand what it is they're expected to do and why, and actually provided a resource here for where you might find some really easy parent-friendly tools on how to make that happen, that can still provide outlets are also developmentally appropriate. So some tools and resources there that can be shared with parents in that way. The last thing here I'll call regulation, and this is really thinking about several different things here. One, our anxiety and our stress. How do we help regulate our own stress and anxiety? How do we help families to do that for their children? How do we also help them to regulate mood? when they're feeling sad, upset, or depressed about, again, losing out on so many opportunities and restrictions, and also behavior. Again, along with extra family time comes just a lot of more time when we're around each other, a lot more time when we're given demands or expectations to follow routines or restrictions on when I can play, when I can't play as parents, and helping parents to be able to figure out how do they help regulate these things with their kids. So a couple of quick easy tips. One is focusing on how to practice relaxation. I often will use the strategy of deep breathing because it's one that doesn't require a lot of training, and it's something that all of us do every day. We breathe every day, and so that's not a hard concept to teach to others, but doing it in a way where we can help teach it in a simplified way. So I use a strategy of the 5-3-10. In for 5, hold for 3, and out for 10. And in your nose and out your mouth. And the whole point being there again is the breath goes in the nose and out the mouth, but that the exhale is twice as long as the inhale. And so it's a simple strategy that kids can understand, adults can understand. And I'll often have kids that practice it with me, tapping their fingers on their legs, 1 time for each finger as we breathe in, 2 times on our legs as we breathe out. But a way to help practice a simple relaxation strategy. Praising enthusiastically and often, so that kids, and this can be often something that's difficult as adults when we're stressed, to find those times when we're engaging with our kids, because when they're quiet, that's when we're getting our work done. But that's also the time to let them know, thank you for being patient with mom while I had to work today, or thank you for figuring out how to share with each other while I was getting this done. That praise and attention is important, and also a part of help regulating kids' mood and behavior. We've included some links to some behavior chart apps that include a way to use simple rewards and privilege to help kids learn how to follow these new routines and expectations, especially when it's things that they're not super enthused about doing. So it may require some motivation to get them on board to follow through with that. The other thing that is listed here are some resources, provide some actual parent guides, 1-page handouts on these very topics that are provided in the link below. Next slide, please. As we also think about parent support during this time and in building partnerships, what we want to remember is that we need two-way communication is really important in terms of fostering those relationships and building partnerships. But what we've seen sometimes is that now that our workspace is also our home space, it gets difficult to figure out how do we make this happen in a way where we can be available and how to make that conversation work. So being able to set up email, phone call, and their online contact opportunities, but setting some office hours for when you can be available. We don't have to be all things for all people at all times, and remembering that our mental health matters too. Even when trying to be a partner doesn't mean that you have to always be accessible. So it's okay to set up some boundaries about when you are available for that communication. Also, providing resources for parents in their native language, giving them an outlet to be able to have some communication and to share in that back and forth is important. And if not necessarily readily accessible, something that you'd want to look into in your area for where parents might be able to access that. A second part to this, as we've talked about before in many of our slides, is that our families are also experiencing a lot of other stressors related to meeting basic needs and getting access to services. Again, we don't need to be all things in the way that we provide our services, but helping families to connect to those in a way that's accessible for them at a time when for some of our families, they may or may not have had to do this before and may not know necessarily where to go. So being able to provide those links or opportunities to share information might be another way to provide some support at this time. Next slide, please. So in this current context, a lot of us have had to very quickly learn how we engage families in this way, provide the support using telemental health. And for some of us, this may be something that we're used to or have done before. For others, maybe not. And just being able to learn this process in and of itself has been somewhat anxiety provoking. I could assume for some. Some things that we know though is telehealth has actually been around for quite some time, and work in the schools, it actually is, there's a lot of research and work that's been done to show that telemental health is feasible, it is acceptable, and it's an effective mode of service delivery. But not only that, it creates an opportunity where we can create access to services that might not otherwise always be available to families. And so it can be a really useful and valuable tool in this context, but also something we can think about as we talk about how we sustain it. So next slide, please. As Angela mentioned before, in order for our telemental health services to work though, we have to also prepare families for how to engage in those. Especially if this is something new to them and hasn't been offered in the past or been utilized in the past, we really need to work with our families for how do we set them up to be successful in this experience with us. And that means that we set up our expectations with families, not just for them, but with them. And I'm going to mention here, there's a lot of content that's been provided in previous webinars and other related work that you could find on our telehealth landing page for the MHTTC. I'm not going to hit all of those points, but I want to redirect folks to know that there's a lot of resources that goes over things like collecting consent and privacy and some of those things too, but I'm going to touch on them a little bit here. One is in getting consent and talking through privacy. Again, as a partnership, what we want to do is engage families in thinking through this with us, letting them know what telehealth services offer, and making sure they're really fully informed about what they're consenting to, and how we not only on our end protect their privacy, but what the expectation would be on their end too, to be able to protect that as well. And what that looks like when we're engaging not just our students, but also our families in the service. How do we protect that for both of them? Setting up the expectation around roles and time. What roles will families play? What roles will our students play? How much time will this take? What we might have as expectations, but what families have to offer, and how do we make it fit? And for some of our families, it means that we need to also be mindful of that, the amount of time that they have to attend and do this work may be less than ideal for us, but how do we work within that to provide them the most support we can? Setting up the room and preparing materials. It's also a part of helping families to set up an environment that's going to be conducive for telehealth, where to position themselves and their cameras, how to find a room and a space that's going to be private. Maybe even also setting it up at a time where, is it nap time for some of the younger siblings while we're working with older siblings, so that we can set you up to be able to have the best experience. And preparing materials like working with younger children, how do we set up the environment in a way that they can attend longer, limit distractions. I wouldn't just say for younger kids though. How we limit distractions. If we're going to be doing some play-based work, how we set up our materials in a way that families have control over them. Maybe they're in bins or in bowls or in bags that parents get out and can put away when needed. So again, helping them to be able to set up their space so that it's conducive for this type of service. The last thing I wanted to hit on here is how we also set up expectations with families for what family time will look like in the service we provide, and what individual time will look like, when we would do one versus the other, and what we would expect with that. How do we set up, again, that privacy or expectation for what our roles will be for families and supporting students, but also giving them space to be able to do some individual work when needed. Those again would be, with the partnership context, it's about how we set that up with our families, answering their questions, letting them share their perspective and problem solving with us about how to make it happen, rather than asking them to make it happen, if that makes sense. Next slide, please. So we talked about this context of what we're working within this global pandemic, and the difficulties that it's brought, and the challenges that it's brought, the changes that it's brought to our practice. But one of the things that we also have an opportunity here for is learning, and how it frames and shapes the way we not only engage families now, but how we want to engage them always. And thinking beyond this time and beyond this next fall when we have to kind of plan for that, but what do we want it to look like? And so we have some real opportunities for learning from this experience in terms of what's worked for us and what hasn't worked. What made telehealth services acceptable, what made feasible, and then in what cases was it not? And in those cases where maybe it didn't work or it wasn't accessible to families, what are some of the solutions that we could look for? I've heard lots of great webinars and other content talk about providing like mobile telehealth services or collaborating with community organizations where hotspots might be available to help support online learning, but also telehealth connectivity. Again, thinking through how you would do that and where you can still protect privacy and confidentiality. A link that's provided here to the National Association for Family, School, and Community Engagement resources. They have provided a nice collective list of resources on how to engage, but also have a webinar on their resources that includes a list of national organizations sharing their plans for how they hope to adjust to the new realities. Tools that are offered as part of this presentation today on how to foster a partnership approach and thinking about moving forward. One is a self-reflection tool that was developed out of some of the work that I spoke to earlier, and how to do some self-reflection on current practices, not just for ourselves, but also thinking broadly about our school-based teams, because partnerships really are about teamwork. And that tool can be used to set some really actionable goals and to be able to work towards, as well as the School Mental Health Quality Guide related to teaming that's provided through the SHAPE system via our partners at the National Center on School Mental Health. So two easily accessible tools that can help guide you in thinking for and planning for a partnership approach in the coming year. Next slide. The other thing that we have the opportunity to think about here is how do we sustain telemental health as a permanent solution, not just a temporary one. Thinking about the resources that we need for that, because it may create an opportunity for families to be able to access support that may have been difficult to access in the past. It decreases disruptions to the work day if they're not taking time off of work to come and be a part of sessions or supporting students, and also allows for regular communication and support with school. But to do this means engaging families and partnering and thinking through how to make that happen on a regular basis, especially when access to technology is difficult. So next slide, please. All of this sounds nice. It sounds idealistic, but we still know that there are challenges to partnering. Next slide. And I think we can't go without speaking to those as well, that the work that we do in terms of creating partnerships can be difficult for a variety of reasons. Sometimes being about perspective, sometimes being about policies or procedures that don't always align to allow that to happen. Bias getting in the way of building our partnerships. If I had access to it, if this is going to date me a little bit, but those of you who remember the movie, not the TV show, Parenthood, there's a scene in that movie where Steve Martin and Mary Steenburgen go into the principal's office to talk about issues their son is having with anxiety, and they reference that he might need to go to a special school, and the parents instantly become defensive and start blaming one another for all of these issues. And the principal's reaction is, having your son go to a special school shouldn't be seen as any reflection of you as parents. And Steve's response is, no, I'll blame the dog. And I think that's one of the interesting things about stigma in these cases, is that we often refer to it as stigma related to mental health. But when we're talking about children's mental health, there's also a stigma associated that if there's something wrong with my son or my daughter, that might mean that I as a parent have done something wrong. And to accept support and to engage in these partnerships also means that we have to accept some vulnerability and some trust that I'm not being judged, I'm not being evaluated. This truly is about supporting my child. And that stigma needs to be addressed up front in order to make that happen. Next slide, please. So I'm going to speak to this really quickly so that we have enough time for questions here. But when thinking about this difficult work, sometimes we will refer to, our families that are difficult to reach. And I put this in quotes intentionally because I want us to start to think about it as less about what it is about families, but more about what we do in a partnership that may or may not facilitate that engagement. And so this list of strategies or thoughts here is one is to get us to think about if we're having a difficult time reaching parents, have we fully utilized our partnerships? And if not, let's take a look first there before we look at what strategies we might employ. The other is remembering that building trust takes time and persistence. This isn't a one and done interaction. It actually requires multiple interactions over time. And that we need to vary our approaches to be able to reach the needs of all of our families, not just some. Partnerships are also a team effort. In order for us to engage families, remembering that in our schools have many different partners or many different players that have a role in that partnership, and everyone needs to be on board with that in order for it to work. And last but not least is the part I want to end on. It's really important that we're attending to family culture and customs, and that building alignment with those, respect of those, and space to make those, make room for different family culture and customs is important when trying to engage them in partnerships to support student mental health. And with that, I have some resources and references that were mentioned today, but I'm going to stop so we can make sure we have some time for questions.
Thank you very much, Brandy. Great information from you, Angela, and Kazike today. We really appreciate you sharing your expertise. We have several questions in the Q&A pod, and I will let Stephanie Winfield, School Mental Health Coordinator with the MHTTC Network, lead us through our Q&A portion today. Stephanie, welcome.
Thanks so much, Jessica, and thanks so much to our great presenters. That was so much great information, and it was great to see how engaged the participants were in the content and sharing so many resources with each other and asking questions and really thinking about the value of what you all presented here today. So we have time for a couple of questions. So I'm going to start this one, hoping that you can lead us off, Kazike. Thinking about what Brandy talked about as the importance and the value of engaging parents as partners, how do we keep parents engaged when they're dealing with so much stress and the tragic events, like you mentioned, of the death of George Floyd and generally just the stress of this pandemic? How do we keep them engaged when their minds are other places? You're muted.
Can you hear me?
Mm-hmm.
Excellent. I think Brandy hit on several different things as far as, the different kind of activities we have for our young people. But I think, our kids are doing the same things we're doing. They're sitting there watching the TV. They're seeing it come up. And what happens, particularly when we come around issues around violence and race and kinds of issues we're dealing with, we tend to avoid those conversations. And what we really want people to do is to go into those conversations, to ask them questions. So what do you think about that? What's your reaction to that? But really, you're trying to set the stage for them to have a reasonable, sensible conversation, because the avoidance is more like that dirty pain, because the truth is they're seeing it. They're having experiences inside. They're very painful. They're watching this man. Unfortunately, some kids are going to see this guy dying. They're going to have a reaction to that. So having a parent or other adult to ask them what they're experiencing, encouraging them to, how does that feel for you, I think is a very powerful conversation to be had, because now you're modeling how to deal with this kind of pain in a clean way versus the dirty way, which is now it's manifest. I build up all this anxiety and fear and frustration about something that I'm not sure how to make sense of, and then I act out. And then I get in trouble, and then you're wondering what's going on with me when with these series of stories I saw on the news about this black man getting killed. And I'm white, and I still don't know how to make sense of it. So I think those are just examples of the kinds of things that I think parents and professionals of encouraging the conversation, instigating the conversation, but also encouraging our parents to check in with our kids about this and giving them other ways, because, you know, we tend to be a little intellectual, the talking cure. Well, oftentimes there might be other ways of manifesting that cure through art and other activities. And as Brandy mentioned, meditation and other kinds of activities as well.
Great. Brandy or Angela, do you want to add anything to that? Thank you.
I appreciate these comments a lot, and I'm going to start using that clean pain versus dirty pain. I thank you for teaching me some new terminology today. That the point I think being made here is that avoidance doesn't make stuff better. Then we start to see that things come out in other ways, and that we need to be intentional in the way that we're engaging and addressing it. But that for some people, that really takes some support. Not knowing, as an adult, I don't know how to do this myself, so I don't know how to do it and help my child to do it better either. And actually, we just had a conversation with somebody prior to this call about how we help our adult provider. We're not always great at it either. I've not had to deal with this scenario myself, and I'll be honest, I didn't get as much sleep as I should have yesterday. And so that there's a lot of reality here that we have some learning to do, and being open to doing so, and being realistic about these hard conversations. They are hard, but avoidance doesn't make them better. And that we're gonna have, we need to spend some intentional time on how we come up with solution-focused ways to address it, and helping not just our students do that, but how our adults might be able to do that to model it as well.
Great, thank you. Next question, Brandy, I'm going to have you start answering this one. There are several questions around confidentiality and respecting privacy, both how to help parents understand the importance of respecting their students' confidentiality when they're on in a telehealth counseling session or something of that sort, but then also how to help children understand the conversations that they might have through telehealth or with a therapist on telehealth are confidential. So kind of those both, how parents help students, how parents can respect students' confidentiality and privacy, and how parents can also help students understand the need for privacy and confidentiality in telehealth.
Right. And so that goes back to that point about how we set up expectations with our families and our students. And so talking about this up front is that confidentiality is going to be important. And actually, I do this in all sessions with families and with students about what things we are going to be private and which things are going to be shared. And so that we're clear about what those things are and when we have limits to those. But engaging our families and our students in problem solving it with us. How can we make a private space? Where can that be? And in what ways will we do this? So that it feels private and it feels safe, and making sure that they can address those questions and those issues up front with you. Making sure that it's clear. Headphones are a nice way to help make some of that feel private as well, so that conversations aren't, even if in a private room, aren't always overheard. You can use chat features for some of that too, depending on the formats that you're using. So we can type out some of those things. It is important though, depending on whether you're providing the service through a school setting or whether you're providing service as an external provider, that you're aware of your HIPAA and your FERPA regulations in terms of what is documented and what isn't, and understanding those, that for some students, they may or may not realize that if we're emailing things back and forth, that may be a part of a record, that we have to keep track of some of these things, or texting, and that what's considered private and what isn't, and setting up the expectations for that. So again, I would say part of the role is up front, setting those expectations up with families and your students, and engaging them in the problem-solving process to help you figure out how to make it work in their household with what they have available to them.
Thanks. Anything else to add?
No, thank you, Brandy. The only thing that I would add is in regards to the expectations as well, is to have conversations about crisis, and also if they can actually put the information or let you know where they're at, as far as like crisis, like the name of the student, you know, that way if there is a critical situation that does come up, you know, you're able to access the student and the family, and also having those expectations with the families as well when a crisis does occur during your telehealth session. So that's really important. I think that's the only thing that I would add to that.
And Angela, I thank you for bringing that up. One quick point I'll make about that as well. And we had to problem solve this as providers, whether or not we would set up an expectation that an adult always had to be in the home or not. And some of this comes down to your level of comfort and what you'll provide. But if you are willing to provide the service without an adult physically in the setting, you do have to have an emergency plan and a way to contact an adult when needed if they aren't also physically present in the home. And I think that is something to think about as things start to open back up and maybe more parents go back to work. If we're still providing some of these services, that plan, as Angela described, is really, really important. And that you know what those numbers are and where people will be at a point in time when needed, because you might have to act quickly.
Thank you for that. I think that was really helpful. Jessica, do we have time for one more question, or do we need to wrap up the Q&A?
I think we have time for one really quick question before we wrap up.
I don't know if this is the quick one, but there was a lot of questions, and Brandy, you touched on this so well with your quotations around the hard to reach or hard to engage parents. But there is definitely a lot of questions around the realities that some parents are working or don't have access to technology, or earlier in their chat, there was a lot of questions around parents and families who are undocumented, who are not getting the same information that other families are getting. So what are some strategies to work with some families that are actually a little bit harder for us and take a little bit more work to engage with? And that's for anyone who would like to answer. Kazike, go ahead. Oh. You're unmuted, but we can't hear you. Yeah.
Now? Yes.
Yes.
You can hear me. Sorry. Technology. When I saw the quote, Brandy, what I thought of was how oftentimes when we have a problem with those that we're serving, we blame them and say, well, it's because you don't have technology, instead of actually asking how the system is failing our kids, or how the system that we have set up is a failure. And so how can we do things differently? And I'm not saying there aren't challenges and barriers and but it puts the responsibility less on our families and kids that we're serving and more on our shoulders, and trying to be creative and asking ourselves, the mere fact that we make a phone call, they may not be able to respond, they may not be able to get on the line and have a telehealth session, but they know you're there as a resource. That in itself can be very powerful. But if we don't even take the time to actually reach out to them, then we're not getting response from them via email. We're calling them, but they're not calling back. But if we don't do those things, they won't even know that we're even a resource available. And so really putting the burden of responsibility, I think, on our systems instead of the people that we're supposed to be serving.
And I think one of the other pieces too, in regards to empowering families as well, is to maybe take a look at if there's like a limited amount of like resources in the community, is like empowering families to be leaders. And then they can, you know, here in California, there's a couple of different concepts called promotoras, and you train community members to be part of that, overall mental health process. So that could be an idea, a creative idea to really access some of those families that we normally are not able to access because, location, they don't have transportation, they don't, all of the different barriers to accessing. So really, kind of like what Kazika was saying is empowering the families and giving them that training and that leadership role to support other families in the community. So those are some of the conversations that you can have with some of your families as well.
Thank you so much. And any questions that we didn't get to, we will, or questions that we didn't get to, we'll be sending out a Q&A document with some follow-up. So thank you, panelists, and great presentation.
Great, thank you, Stephanie, and thank you, everyone. We are at the top of the hour. We are so happy that you joined us today. It has been our pleasure bringing this session to all of you. Today's presentation and slides and recording will be sent to everyone in a follow-up email over the next few days. We will also make these materials available on the MHTTC website. Like Stephanie just mentioned, we will be putting together a frequently asked questions document based on the questions that were asked in the Q&A pod. A reminder that this is the second session of 3 in the MHTTC School Mental Health series. We do have our third and final session coming up next Friday, June 5th, at the same time as today. We will focus on strategies for addressing trauma, crises, and grief through telemental health. Next slide. Lastly, just a very quick reminder to please take a moment to complete a brief survey about today's training. You will be redirected to our survey upon closing the Zoom webinar. We'll also be sending the survey link in our follow-up email to everyone who attended today. Thank you again for joining us. Please take care of yourselves and have a beautiful weekend. Bye.